Bledsoe. I'm a third semester nursing student. This is my fourth year at Fresno State. You know, when they ask you in class, what do you want to be when you grow up, I always thought a nurse or like a veterinarian, something caring for babies or children or animals. And then throughout high school, like looking more into it, I thought, yeah, nursing is like the perfect fit for me. The Fresno State nursing program is one of the best in the state. It's one of the largest, and it just has a really good reputation. It's very competitive. They only accept between 50 to 60, it varies per semester. So they take the top, top grades. So it's purely off of your GPA. So since it's so competitive, most people like strive for straight A's to apply, so you better your chances of getting it.
So we walk into the patient's room, and then we're going to introduce ourselves as student nurses. Hi, Mr. Shannon Shaw. My name is Ruth. I'm going to be doing a quick assessment on you with my colleague here, and we're going to be starting by taking their vitals.
So it's called the NRC, the Nursing Resource Center, or the Skills Lab, and pretty much it's set up like a mock patient room. So you have a bed, you have a mannequin, and you can actually hook up the mannequins to have real breath sounds, real heartbeats. You have like oxygen on the wall, you have the bedside table, we have mock medications. So we learn certain skills like how to listen to their heart sounds, how to listen to their lung sounds, we learn how to give injections. So after we learn that, we get a practice on the mannequin, and then we're tested. We're given like a fake scenario, like, this is a 50-year-old male and he has COPD, and you have to, assess his lungs and give him this medication. So we literally act on the patient, and we have a tester who's watching us and marking us down or giving us points for what we test. So this is what our skills lab looks like. We call it the NRC, the Nursing Resource Center. We have 2 rooms, and they each have 5 hospital-like beds, and they usually have mannequins in them. Right now we don't for testing. Sometimes they use real people, and sometimes they use a mannequin. So if we take a look at this first bed, it's pretty much set up just like a real hospital bed. It moves up and down. It does everything a normal hospital bed would do. It has all of your supplies like gloves, hand wash. We have all the oxygen and the tubing, suction and tubing. Pretty much we have everything set up so it looks like a hospital room in a real hospital bed. The day in the life of a nursing student, we often have very early classes, or we have to be at our clinical site very, very early. So a nurse, or actual RN working at a hospital, they receive report from the night shift at 7 a.m. So we have to be at our clinical site before 7 a.m. So 6:30 we're getting there, or sometimes we have 7 a.m. classes. So clinicals last 6 hours. Some semesters you have it once a week, and other semesters you have it twice a week. And then we have lectures, which are like 3 hours long. So, and then on top of that we have practicing in the skills lab, so that's extra time. And then all the studying on top of that at night, it's a lot of work.